So good afternoon, everybody, and welcome to this QPS TalkTime. My name is Louisa Power. I'm a medication safety specialist pharmacist, and I work with the National Medication Safety Programme, and we're part of the National Quality and Patient Safety. So as I said, you're all very welcome to join us today, and we're looking at a really important topic, I think, across the system, and we're going to be looking at meds on time, every time, and enhancing medication or enhancing Parkinson's medication safety with some practical resources. So we have a really packed agenda today. So I suppose these are the learning outcomes and what people are going to learn today. So you're going to hear about a very successful patient partnership, which was to develop a video which supports the meds on time every time in Wexford General Hospital. You're also going to gain an insight into the Parkinson safety alerts, which were issued by the Irish Medication Safety Network. And you're also going to learn about the meds on time every time resources from our colleagues in Parkinson's Ireland. So we have a wide range of speakers today. We have representatives from Wexford General Hospital. So we have Ali Bone, we have Maria Randalls, and we also are very fortunate to have Liam, who's our patient partner. We have Niamh O'Hanlon, who's joining us from the Irish Medication Safety Network. She's the chair of the Irish Medication Safety Network. And also Lisa Wynne, who's a Parkinson's nurse with Parkinson's Ireland. So we are ready to go. It's great. I'm just looking at the attendees here, and we have people from right across the system. We have people from community nursing units, we have people from hospitals, and we have people who are working with senior citizens in long-term residential care, and we have people from primary care as well. So we are going to kind of get right into it. So first and foremost, who I'm really I suppose delighted to welcome is Ali Bone, who's the Patient Safety Strategy Coordinator in HSE Dublin, Maria Randalls, who's the Head of Pharmacy Services in Wexford General Hospital, and Liam, who is our patient partner. So I'm going to hand over to you guys. Ali, I think, is going to go first, and then we're going to hear about your very successful, I suppose, patient safety video.
Louisa, thank you so much, and thank you for the invite today. We're absolutely delighted to be here. So at the time, I worked in the Quality and Patient Safety Department in Wexford, and we had some incident reports received by the QPS department, and they were around delays or omissions in time-critical meds, which included Parkinson's meds. So we looked at, through our Medication Safety Committee, how we could do a project around quality improvement, and there was 3 elements to that. So one was in the development of the poster that you can see on the right-hand side, and that was by way of empowering patients to let staff know in the emergency department if they were waiting and hadn't received their meds. So that's up in an A0 size poster in the ED waiting room as well as all the rooms. So that was one element. The second element was around a staff survey. So I suppose in line with quality improvement methodology, we wanted kind of to establish a baseline. So what do staff want to know? How can we support them around, in particular around Parkinson's meds? And 100% of the responses from that survey identified that they would like to know more about Parkinson's meds. And that kind of aligned with our findings, really, because we asked the staff what was their understanding of the impact in a delay or omissions in Parkinson's meds, and all of the feedback related to the motor response. Now we know that there's a lot more symptoms which have a huge impact on Parkinson's patients when they have a delay or omission in their Parkinson's meds, and that led us to linking in with Lisa from Parkinson's Ireland. And I suppose the third aspect of our quality improvement project was, what about our patients? What do they want us to know? And that leads us into the video that we developed, and we might move to that then. It's a 5-minute video, and in it we have Maria Randalls, who's Chief Pharmacist from Wexford. We have Professor Michael Reardon, who is Geriatrician Consultant in Wexford General, and Liam, our patient partner.
So today we have Liam Power with us. He lives with Parkinson's disease, and we would like to raise awareness around patients at Wexford General who have Parkinson's disease and how we can manage them best. So
I'm Michael Reardon. Liam, I'm going to ask you a few questions about yourself and your Parkinson's. Is that okay? Tell us a bit about yourself, Liam.
My name is Liam Power. I'm a semi-retired, self-employed person. I'm living in Wexford. I was diagnosed with Parkinson's in 2019.
And Liam, how does it affect your life?
It's annoying. you have a tremor, you lose dexterity in your hands, your writing suffers. It's an inconvenience.
Okay.
But I don't have it severe yet, so I'll probably end up with it.
Yeah.
We'll see where that goes.
So Liam, we're here to talk about hospital admission, and what problems do you think you might face or you have faced if you were admitted into hospital with the medication that you're on for Parkinson's disease?
Well, Parkinson's disease, your medication needs to be taken regularly and recommended 3 or 4 times per day, depending on your dosage. And then it has to be taken before meals by a half hour or so. I take Cinemet 3 times a day, 8 in the morning, 12 o'clock, and 4 o'clock in the afternoon. And that roughly coincides a half an hour before my main meals, because protein in the meal interferes with the uptake of Cinemet to the body.
Of course. So what message would you like to give to, say, nurses, for instance, who are prescribed or giving medication in hospital to patients who come in to hospital?
They should be aware of that it's time critical. It's not, you can't give all the medication to a Parkinson's person when the schedule says, if the schedule says at 6 o'clock in the morning that you dispense medication, you can't give all the doses of the medication to the Parkinson's person. Parkinson's people need medication at a regular time, at 3 or 4 hour intervals, because of the on-off time that the medication gives the Parkinson's person.
So what you would say as advice to nurses or people who are administering medication is to listen to the patient when the patient comes in, or possibly family members who are giving medication regularly and know when that medication is due.
It depends on the patient themselves as well. Some people are in control of their own medication,
Yes.
other people depend on their family or other experts to medicate them.
Okay.
So I think a message to hospitals and other caregivers is that they need to talk to the Parkinson's person or the care or whoever family member who brings them in. Dispense the medication at regular times rather than the schedule that might be set up in the hospital.
Okay. And there are medications that can be given when the patient can't eat.
Yeah, I guess that is an issue that can arise. People, may not be able to take the tablets. It may not be possible to slide a tube to administer the tablets, so a patch preparation. They are available, and it's an important issue for teams and for everybody looking after the patient to be aware of, and to quickly transition to a patch where appropriate.
Liam, I'd like to thank you for coming in on behalf and representing all patients with Parkinson's disease, and for educating us and for educating everyone who deals with Parkinson's disease in the hospital. And I hope this will be helpful for all patients who come into Wexford General Hospital in the future.
That's great. And Chris, thank you for showing that video, which I think is really, really insightful and a really, really important insight really in relation to the Parkinson's and the importance of getting the medicines on time. I might hand over to you, Maria, to maybe tell us a little bit about your, I suppose, experiences in the development of this video.
Thank you, Louisa. Well, after doing the survey, our priority was increasing awareness. With limited resources, we asked ourselves, what can we do? So meeting Liam and working with Liam on this project has focused our minds and, on what we needed to do at Wexford General Hospital. From this experience, I realised how important it is also to pick the right patient partner. Liam's message is quite clear, and we've recorded the video in one take. He is hopeful and encouraging, and he wants us to do better, to do our best for people living with Parkinson's. So to increase awareness and to motivate staff, we engaged with Lisa Wynne from Parkinson's Ireland, who provides education sessions regularly, and they were great, very relevant and very well attended by staff in Wexford General. At the time, we also targeted staff huddles, governance meetings, and sent out memos. And I spoke with other pharmacists also about the challenges and the considerations with Parkinson's medicines, you know, the safe storage of medicines, supervision of administration, determination of who can safely self-administer. Some of the issues are complex, but we must find solutions, even when those solutions carry risk. I think we need to confront the risks involved if some patients take their own medicines while in hospital. I mean, we're all aware that change often happens slowly, but it happens every day. And with new systems and technology coming through, we need to know our destination in order to make our way there. So it's listening to Liam and listening to our patients carefully and ensuring timely administration of medicines, and particularly Parkinson's medicines, and you know, for this patient group.
Thank you so much, Maria. And I suppose we're all living in a very busy world, and you know more those in pharmacy as those that are on the ward and across the hospital. And I suppose, what has been your experience in being able to sustain this important quality improvement from your perspective?
Well, we introduced time critical medicine stickers for Parkinson's medicines only. The management of Parkinson's medicines remains an item for discussion at the Medicine Safety Committee. We presented an audit at our biannual Wexford General Audit Day in June, and the plan is to re-audit this area. We issued a safety memo, a concise safety memo in July on the importance of timeliness. Overall, in view of the perceived effectiveness of the education sessions provided to staff, we plan to put more resources into keeping these sessions up, and in fact we plan to shift to providing more directed education sessions to staff in areas such as antimicrobial stewardship and sepsis. So we continue to look at our practices also around self-administration of medicines and how we can move towards this. We have a 96-bed wing due to be built, you know, in the near future at Wexford General, and plans are in place to include medication boxes for each room. So I really think it's about keeping timeliness of medicines kind of to the fore of our minds as we move forward and integrate IT solutions into practice.
That's great, Maria. And I think there's something there for everyone in relation to, I suppose, how to sustain improvement, not just, I suppose, through those technological advances or some of the more structural changes, but also things like audit and education and training as well. And I suppose, Ali, you know, this is such an impactful video, and I think made even more impactful when you hear that it was done in just one take. I suppose, what was your key takeaway that you'd like people to hear today?
I think, Louisa, aside from the key messages that Liam has in the video, which very much came from our patient partner, it's to emphasise that the importance of that patient engagement piece. And I suppose particularly around Parkinson's meds, where there's nothing like the patient themselves to tell us their own routine, their own body, they know their own limitations, they know their own triggers. So for me, it was really how much Liam educated, you know, myself and Maria, and I'm sure Prof. Reardon as well, you know, throughout that process. So for me, it was, you know, that important piece of engaging with the patient themselves.
And I suppose, Ali, you've teed me up very nicely to move over to Liam. And I suppose, Liam, I'm really interested to hear what motivated you to become a patient partner.
Hi, everybody. Thank you for inviting me to the QPS TalkTime. Really, how it happened was through conversations with Alison about medication safety. And we discussed Parkinson's then and the timing of the dosage of Parkinson's and the impact it had on people, Parkinson's patients, around taking the Parkinson's at the right time and its effect if it's not taken on the on-off periods that are particular to the Parkinson's medication. So we felt that between myself and Alison that I as a patient would have some input and a point of view, which led me to participate in the video, and I was more than happy to do so.
And a very important point of view and a very important perspective. And Liam, have you had an experience, yourself of, Parkinson's medicines being delayed whilst you've been in hospital?
No, not really. I suppose I've been lucky. I've only had day procedures in the hospital since I've had Parkinson's. I haven't been in there for long periods of time. But I find I do it myself. I miss a dosage because I'm engrossed in a task, and it takes ages to catch up and get the sequence and the timing back again. So I suffer from tremors, anxiety for a while until the second dosage catches up.
And it's really, I suppose, impactful for us to hear, I suppose, the impact on you and how, I suppose, that impact can be sustained, as you said, for a period of time, even if it, even if you forget the dose, and what the impact that could have on someone who's in hospital as well. And I suppose finally, Liam, do you have a key message for our audience who are tuned in today?
Well, I do. I think it's been covered by Alison in the previous talk or previous speech there as well. It's vital for the patient's well-being that they receive the correct medication, the correct dosage at the correct time, but according to their particular circumstances and their medical regimen.
Liam, thank you so much. I suppose it's wonderful to hear from a patient perspective and from a patient partner, that message, because it really does resonate with us. And also to thank Ali and Maria, and we'll be coming back to you later on in the session when we get to the panelist discussions and the Q&A. So we're now going to be moving on to setting the scene, and we're joined by Niamh O'Hanlon, who is the chair of the Irish Medication Safety Network. And Niamh is going to tell us, I suppose, who the Irish Medication Safety Network are, for those of us that don't know who the Irish Medication Safety Network is, and the important work that they do. So Niamh, I'm going to hand over to you.
Thanks very much, Louisa. It's lovely to be part of such an illustrious panel, and thanks to the HSE QPS TalkTime for the invite. I'll just take 10 seconds to thank our pharmacy technician colleagues. It's World Pharmacy Technician Day today, and they're a cornerstone of hospital pharmacy, and with their help it allows hospital pharmacy reach its potential. So thank you to pharmacy technicians today. So who are the IMSN? The Irish Medication Safety Network is a network of pharmacists in public and private Irish hospitals. We've been on the go for the last 18 years. We're a voluntary independent group, and our goal is to improve patient safety with regards to the use of medicines. Our vision is to be a trusted national voice in medication safety in Irish hospitals, influencing policy, practice and standards at a national level to ensure the safer use of medicines across the healthcare system. We produce publications for Irish hospitals and hold an annual conference to share best medication safety practice and learning. Today, I'll speak about the collaborative work undertaken with Parkinson's Ireland to enhance the safe care for patients with Parkinson's in Irish hospitals. So this safety alert here was initially developed by the Irish Medication Safety Network in 2018, but last year, and actually about 18 months ago, we approached Parkinson's Ireland to see if they wanted to work with us, to collaborate with us in updating this guidance. And it has been so beneficial to have their feedback to include in the safety alert. And for those of you, if you want to read, and it echoes, I think, what Liam was saying, I know earlier, about what are the issues at hand here. The evidence of harm, and this is something that Parkinson's Ireland hear all too frequently, and many of us in healthcare will be familiar with, particularly for patients who are admitted to hospital for reasons other than Parkinson's. It may be related to Parkinson's, they may have had a fall, but they're not in for a review of their Parkinson's medications per se. So this gentleman's experience: 4 years ago, I was walking with the aid of a Zimmer frame. I fell and was admitted to hospital with a broken arm. I didn't get my Parkinson's medications for a day, and when I did, not the right dose. I left hospital in a wheelchair, never to walk again. The right medication on time with early mobilization would have seen me walk again. After all, I didn't break my leg. So this is an all too familiar scenario that we see, and it's preventable harm. So we collaborated with Parkinson's Ireland for the Meds on Time Every Time an initiative, which is something which is a drum we can't beat enough, and why we're all here on this webinar today. So the guidance from that we produce is in three forms, like what's the issue, what's the evidence of harm, and how to reduce the risks. And the risk reductions or the recommendations tend to be practical and across hospitals, whether you're a large teaching hospital or smaller hospitals, they have a practical focus. This relates to the other presentation just on screen. There's the time critical medicines. This is one of the medicines, and you'll have seen the mnemonic earlier of MIST. There's another one here, patient ASAP, that the IMSN published last month. Parkinson's or movement disorders is one of a number of medications that it's essential that are given on time, otherwise it will result in patient harm and can even be fatal. So we can see there Parkinson's meds, anticoagulants, and transplant meds, insulins or for patients with diabetes, patients with epilepsy, narcotics or opioids for loss of pain relief, treatment with steroids, the impact that can have if they're delayed or omitted, and the ASAP is antimicrobial, the impact of sepsis if antimicrobials aren't given in a timely fashion, stat doses because of where they're located in the drug chart or even electronic charts that they can inadvertently be omitted, antidotes, and finally psychotropics there. Just in relation to other safety alerts that we've developed with Parkinson's Ireland over the last 18 months, contraindicated medications in Parkinson's disease. And this is something that we had feedback from Parkinson's Ireland on, that patients themselves, their carers, their advocates were aware of certain medicines that should be avoided in patients with Parkinson's. But even with that awareness, that they had come across, I suppose, stumbling blocks in Irish healthcare. Well, that's what's been prescribed, or even cultural setbacks where people didn't want to challenge something that they thought might be an issue for someone that they cared about. So there are certain medications which definitely will worsen Parkinson's symptoms, and there are alternatives available. So that this was used as a tool, I suppose, from the Irish Medication Safety Network and Parkinson's Ireland to highlight if you have someone with Parkinson's on these medications, that there may be better alternatives. So there are better alternatives available. And finally, in the last month, the most recent document we've worked on is constipation in Parkinson's disease. Constipation is a symptom of Parkinson's disease, and unfortunately means that the medications can't be absorbed to their full potential. And if you can address constipation, you can get much more bang for your buck. So rather than having to escalate medicines for Parkinson's disease and the associated side effects with them, that you, by regulating your bowel habits and systems with constipation, that we can address a lot of the issues that people have with Parkinson's. So what next? When we go back to Meds on Time Every Time, and as Liam mentioned earlier, that there are certain cohorts of people with Parkinson's who could self-administer in Irish hospitals, and this is a gold standard from both Parkinson's UK and Parkinson's Ireland. Many people with Parkinson's can and do take their own medication daily. We believe that people with Parkinson's who want to manage their medication in hospitals should be allowed to do so, providing they're well enough and have been assessed as safe to do so. And as Maria mentioned earlier, it's something we can look towards, but it's something that is a challenge for us and something that we'd like to focus on.
Thank you so much, Niamh. There was so much in those slides, and I suppose having worked as a specialist pharmacist in care of the elderly for a number of years in the UK, it really brought me back to those days, and I suppose the importance of, the timeliness of the medication. And as you said, Maria did, I suppose, mention the complexity of the self-administration. We know it's the gold standard from Parkinson's UK, and I suppose, have you any ideas as to how we could implement that, Niamh, here in Ireland?
Thanks, Louise. Said one of the key things that I learned actually from Liam was when he was talking, or in preparation for today's talk, that today's 7:30 or 8 a.m. medicine for a patient might be tomorrow's 7:30 a.m. or 7 a.m. and that the patient themselves knows best when that fits, when it suits them. For a system, it's very difficult for us to try and move or to maneuver to suit that type of schedule. So if we could, there are risks with us not considering self-administration. So if we can consider, it's very easy for us to go straight for what are the risks if we do this. And many organisations will have self-administration guidance in practice, but they may be more low-hanging fruit. To facilitate patients with Parkinson's take their own medications actually alleviates some of the risks for them. Some of the challenges are in relation to safe storage, but also capacity. So if we build a framework and with patients and with existing frameworks within the hospital, that we can look to try and emulate good practice, such as in Our Lady of Lourdes and in University Hospital in Limerick and in our own hospital in Vincent's University. Advanced self-administration, maybe without us, it's nice to have those side lockers and the medication storage, but even without those, what can we put in place? So watch this space. There'll be some national guidance coming on that. Thanks, Lisa.
That's great, Niamh, and thank you so much, I suppose, for sharing some of that wisdom. And it's great to hear that that is, going on, that we are seeing some self-administration and some pockets of good practice and what we can learn from those going forward. So thank you so much. So next we're going to move to Lisa Wynne. So we've heard about Lisa already and the great work that she did in partnership with our colleagues in Wexford General Hospital. So Lisa is a Parkinson's disease nurse specialist with Parkinson's Ireland. And what Lisa is going to talk to us about today is enhancing Parkinson's medication safety with the practical resources that Parkinson's Ireland has. So Lisa, I'm going to hand over to you. So thank you very much.
Thanks, Louisa, and thank you to QPS for inviting me to talk today. So I'm just going to give, I suppose, a brief explanation as to why timing is really crucial and what impact it might have if those doses are missed. If we just look at, I suppose, the consistency and control with Parkinson's, the way we manage Parkinson's symptoms is through medication management and optimizing that medication. And so the timing is so important, and it's been mentioned about the drum that we beat. It's a drum that we beat on every single point of contact with people with Parkinson's or their family members in order to manage their symptoms effectively, because we know that medication is what manages Parkinson's symptoms best. We know that delays can cause distress, and for some, Liam pointed out that he noticed his own symptoms returning when he missed a medication, especially for those in hospital who may not be in hospital for specific conditions related to their Parkinson's, but the knock-on effect of having a missed dose or a late dose, which can increase not only the movement, but the non-motor symptoms that are lesser well known in Parkinson's, but are usually the ones that cause the most distress. The stiffness and tremor, which we are aware of, but the decrease in the missed dose of a medication can increase anxiety, can increase speech and swallow issues. And we see and hear of people who miss doses, and maybe not one or two doses, maybe a few days of their Parkinson's medication, and it causes a significant shift in their baseline, that when they do return home, they no longer are at the baseline that they were, or their mobility status is significantly changed, or cognitive status. And so when we beat that drum about medications for Parkinson's on time, every time, it's really to promote patient independence, to promote confidence as well. So knowing that they are aware that the health professional and the health team looking after them are aware of the importance of the Parkinson's medication on time, which isn't seen everywhere, but it is improving. And it's improving from both us, ourselves, the health professionals, and our expertise and giving talks like this, but also from the patients and their family members listening to us and hearing us speak about it so often and the importance of it, having the self-advocacy and the power themselves to explain to other health professionals how important it is. We also have to remember that when people may go into hospital, and it may be, as I said, something unrelated to their Parkinson's, if they are missing their Parkinson's medications and they have that shift in baseline, their recovery is then impacted. Their ability to partake in physiotherapy exercises or speech and language assessments is also impacted. And so that has its knock-on effect on also the length of time and complications in the stay in hospital. Bringing it all back is to bringing it back to patient-centered or person-centered care. And that's what we practice, and that's what we try and promote, is that we're giving the information to the person and to the family members who may speak on their behalf, and in order to bring the care of somebody with Parkinson's back to the basics of timing of medications to manage their Parkinson's symptoms. And I suppose behind all of the work that we do and all of the education and all of the awareness that we promote, it's one simple reason, and that's because somebody living with Parkinson's, and as it's been mentioned, taking medication isn't just about routine. And no routine is the same as the next day or same as the next person, but it's what helps them stay in control. And when we go into hospital and lose that little bit of control, this is another way of giving that back to them. Getting medication on time is essential for not only safety and health, but also for quality of life and well-being. And so it's, I suppose, our work is shaped very much by medications on time. It's something that we hear, and as Niamh has given you examples of first-hand stories and first-hand positive stories we hear, but also first-hand negative stories, unfortunately, they are getting less. And we would hope to get to a time where we hear a lot more of the positive outcomes of people who are coming across hospital admissions or encounters with health professional staff who are aware of the importance of timing of medication. And so we work with regards to education and training, which is a pinnacle pillar of Parkinson's Ireland's work, increasing awareness for not only people with Parkinson's and their family members, but also health professionals of all levels. And the collaboration piece is really crucial to what we do. We're a very small team. We have 3 nurses on our team of 7 within Parkinson's Ireland charity. And so we have been very lucky to work with Louisa and her team, and with the IMSN and with Ali in Wexford as well, to provide an opportunity to speak about this to bigger cohorts, to different health professional groups, in nursing homes, in community settings as well. And really, without those collaborations and that relationship that we have built up, this wouldn't be possible. It would be a very difficult task to do without them. A huge and very important part of our work is advocacy. It's a very important pillar of Parkinson's Ireland, promoting awareness across all services and across all communities, and really providing the tools and the resources for self-advocacy is very, very important in our eyes, so that it's not only the health professionals that we're reaching out to, but also the family members and the person who is living with this complex condition day in and day out. And so it is something on every point of contact, on our newly diagnosed Zooms that we run, on our nurse clinic that we run on a Wednesday. We are always mentioning the importance of medications on time. And we would speak to people who could be a couple of weeks diagnosed, and they're fully aware of it. They have been told medications on time, and how to optimize their Parkinson's medication. And it's fantastic because it's one less, I suppose, that we have to target or give the explanation to, and also they've got their prescription and they've got the education at the beginning. We also speak to people who could have Parkinson's 20 years and were never explained the importance of meds on time. So newly diagnosed or living with Parkinson's for a long time, it's equally as important for everybody that has the condition. And so for the resources and why meds on time matters and how we can help in Parkinson's Ireland. So we have built a suite of resources and tools for people, for not only those with Parkinson's and their family members, where we explain how to manage your symptoms, to optimize your medication, and the reasoning behind the medications on time. We also have developed awareness sessions and provided awareness sessions multiple times, especially in the last year, thanks to our collaboration with the IMSN and with Ali, on the importance and inspiring awareness, and to try and keep that drive going. and supporting different initiatives that are being run throughout the country in multiple different settings. We have developed support materials as well, which supports consistent and timely medication in everyday care. And that includes our magnets that we have. We also have medications on time stickers. We have information leaflets for both people with Parkinson's for the frequently asked questions, and also for health professionals in situations where a swallow might be impaired or medications are unavailable, and where to look for the further information and guidance, which may not be available, because this would usually happen when somebody presents to an A&E on a bank holiday weekend, and where the staff aren't aware of the Parkinson's medication and the routine and regime that's necessary around each one. And another thing that we have started to provide is tailored sessions for organisations. And more recently, we provided a in-house training session to a nursing home where we had domestic staff, from cleaning staff, catering, nurses, GPs, and pharmacy staff. So it's really getting the word out to everybody that may come across somebody with Parkinson's, be it in day-to-day work life or be it in a personal circumstance. This is just to give you an idea of all the resources that we have available, all the different posters that are available, the passport and the information leaflets.
Thank you so much, Lisa. And I suppose, Lisa, just as a quick reminder to people, where can they access the resources, and I suppose who can access them?
So anybody can access these resources. They're available on our website, which is parkinsons.ie, or they can email us at nurse@parkinsons.ie, and we can have these posted out. For any talks or any information sessions, they can just put a call through to the support line and we can contact them with a suitable date, be it in person or online. Louisa, we're quite open to doing both. That's
great, Lisa. And I suppose having, you know, looked after and cared for people with Parkinson's who've access to your services and knowing how invaluable your services are, can we as healthcare professionals refer patients or people who are living with Parkinson's directly to your services?
Absolutely. Yeah, we're open to anybody, any referrals. They can self-refer or it can come from acute services or GP community services, anybody. I suppose my thinking is that if we can give that little bit of information and those early pieces of nuggets that people need, every little bit helps.
Thank you so much, Lisa. That has been, I suppose, really insightful, really useful and really practical, you know, to hear both about the work of Parkinson's Ireland and then the resources. So I suppose that brings us to the end of the presentations that we have. So we're all going to kind of come together now and we're going to look at some of the questions. And Juanita, you're going to come and take over for me before my voice decides to give up. And yes, thank you so much.
Oh, thanks very much, Louisa, and thanks very much to everybody who's presented and shared their knowledge this morning. I think there's a lot of information to think about there. I suppose the first thing that comes to my mind is, you know, meds on time every time, you know, and I think of any time I've ever been in hospital, you have the trolley that comes at a set time, and that's the time that you get the medication. So I'm wondering, you know, and maybe Louisa, you might like to start, and if others want to jump in, do that piece about, you know, is there advice for staff who actually want to make this happen? You know, what's the best way to do that? You know, how do you get started whereby you have that conversation with the patient to find out what time works for them, and then the reality of actually making that happen on a busy ward? Are there some suggestions for staff around that?
Well, I think, Juanita, you know, you kind of hit it on the head there in relation to, you know, talking to the patient. And I suppose it goes back as well to when we talk about medication reconciliation and getting that best possible medication history from patients. So it's really important to know what time the patients take their medication on. At what would you say, at risk of doing a bit of promotion for the National Medication Safety Programme, we have the My Medicines list, which is available on our website, which people can print off. We've also got the professionally printed copies that can be gotten from healthpromotion.ie, and there is a column there where people can actually write the individual times. So there's a comment section where people can write the individual times, and I think that's very important about the times that they normally take them. But as Liam alluded to, today's 7:30 might be tomorrow's 9 o'clock. So, it's important as well to be flexible in relation to that. And I think when Maria was talking, she was speaking, around their new, the new large unit in Wexford, and even, going to that kind of, pharmacy being involved in those planning stages, and nursing staff being involved in those planning stages, and, actually identifying what might be needed from a self-administration piece, and also what might be needed from, a medicines administration perspective, trying to be flexible in relation to that. And I'd be interested to hear, Maria, from your perspective in Wexford, have you had, I suppose, any nuggets or any kind of information as to how to, be able to be more flexible on the medication rounds for people?
Well, it is very challenging. The nurse can round it at various times, can be held up for, various reasons. I think the important piece is working closely with nurse practice, and obviously listening to the patient, trying to accommodate patients on a patient by patient basis, but also looking at the systems in place. And I think, as Niamh mentioned, challenging our rigid views on risk and controlling risk. Pharmacists are, it can be easy to identify a risk, but also, we have to challenge them, I think.
You don't want a situation where someone is holding on to their tablets and saying, well, I'm not telling anyone I'm taking these, I'll just take them when I need them, that there is that openness there. Because I have seen patients in the past saying, sure, that's not really a tablet at all, or that's just something I take every day, and they don't necessarily realise the importance of it. And I think the other thing that struck me as you were talking, and I just see there's a few questions coming in there, one of them was around the things that impact the effectiveness. So the timing is one of them. Constipation was something else that was mentioned, and a lot of people might not know about things like that they can have an impact themselves. So is there advice that some of the healthcare providers that are on should be giving to patients around things that are important? Are there specific things that you would be saying you should absolutely be mentioning this to somebody that's getting Parkinson's medication for the first time? And maybe Lisa, or maybe another member of the team, Marie, you might like to jump in there and see, are there specific things that you would be saying these are absolutely essential for you to know as a Parkinson's patient?
Yeah, so there is, Juanita, and to complicate it a little bit more, it's a specific family. It's the levodopa family of medication. That apart from their timing, with or without food. So the guidelines is without food, because proteins in food interact with protein in the tablet, but also the levodopa has to get into the jejunum to be absorbed. And so therefore, if it's taken with a meal, the benefit is not seen. It may not be seen at all from that tablet, or it could take an hour and a half before it gets into the jejunum. The constipation is something that we never get away without speaking about. So it's in every single talk that we do. And that's, like Niamh said, it's because of the Parkinson's, but also your levodopa medications have a side effect of constipation, and then the inadequate fluid intake as well. But it's the number one reason for medications not to work as effectively. And then there was a checklist, or a top 10 reasons for change in Parkinson's symptoms, that even just for people to be aware that that's available. It's on our website. It's in the IMSN alert as well, number 3. There is usually a reason for a change in Parkinson's symptoms. And so if you can identify it, treat it. You rarely need to make any changes to Parkinson's medications. But there's another, apart from the constipation, which is the most common, there's possibly another 9 to 10 reasons as well that are up there.
That are important. And Liam, just coming to you from your perspective, the first thing I was very impressed with the idea that you did that in one take. We've done a lot of videos over the years, and I don't think we've ever done something like that where it's just been one take. So I'm going to come back to the other panel members in a minute and ask them, how did they find you as a patient partner? But before I do that, is there anything that you would have liked to have known when you were first diagnosed as a Parkinson patient that mightn't have been mentioned, and you would have said, God, if I'd known that then, it would have made it easier?
Well, honestly, the timing, it wasn't emphasized when I was on Parkinson's initially.
Okay.
I was just told to take my 3 levodopa per day and should be all right. But then I figured out that it was wearing off, so I had to change the dosage to more frequent. And then I learned that timing was critical. And then I learned that as was said that having medication outside or with food was contradictory. And then constipation came along as well. So
Okay.
we're covering all the
all the things.
spectrum of suffering from Parkinson's disease here. So I think everybody's learning from it.
Yeah. And it is, I suppose, having those conversations early. You mightn't always recognize the significance of it either. You know, the way sometimes, like I've been the doctor myself, where they say this is important, and you go, okay, that's grand, but you might not necessarily remember it when you go out. So there is something about maybe hearing it more than once, and also having it stressed that it is that important. So I think the video is really good for people to be able to hear that. And just in that space, I think hearing from somebody that has Parkinson's, you're much more inclined to listen to somebody. So coming back to the patient partner, just Maria and Ali, how did you find this patient partner? Because it's the one take. I'm so impressed.
I can jump in there, Juanita, if you like. So Liam is actually a family member of mine, and we had numerous educational conversations outside in the lane in relation to his Parkinson's, and he actually gave me so much information that I didn't know about Juanita. What he didn't know was in the back of my head, working in quality and patient safety.
Get a job.
Yeah, yeah. He didn't realise that at the time. And with no coercion now or pressure, eventually I broached the subject of maybe, would he be interested in working with us? And I suppose, Juanita, sometimes we kind of maybe overthink that patient partner when it's standing right in front of us. Sometimes it can be very complex and finding the right person and confidentiality and whatever. But actually, he was right in front of us. And it was one take, and it was very much Liam's message. What do you want us to know? So yeah.
Well, I think it's fabulous, and I think it's a fabulous resource for people to be able to access, not only in Wexford but beyond as well. The link has gone into the chat there for people to be able to use it. I see there's a few comments here. I'm going to pass back over then to Louisa, but I know a number of people are using stickers on their medication record to increase awareness of giving meds on time. And I think that's probably for multiple conditions, probably not just Parkinson's, and being aware of that I think is good. And the other piece as well is that I know Marie Brennan has put in that they have a video coming out, and it'll be shared on the Matter website. And again, there's just resources there that might be helpful rather than having to reinvent the wheel. If it's a message that's applicable and a broader, just to have a look at them, I would say. So just to say thank you so much to the panel and for people for sharing your questions. I'm going to pass back over to you, Louisa. Thanks, everyone.
Thank you so much, Marita, and thank you to Marie and Jane for sharing, I suppose, their new video, which will be shared through on the Matter website and also on the IMSN study day on the next month, which we have been involved in as well with the National Medication Safety Programme. So what I'm going to do is I'm going to go around the panel, and I'm just going to ask for people to give, I suppose, their final comments or what they'd like to leave the audience with today. So Lisa, you're first on my screen, so I suppose kind of final comments or what you'd like to leave the audience with today.
Final comment, just to educate yourselves, just to be a little bit more aware that everybody with Parkinson's is different, and so their regime and their medications and symptoms are all different, but one dose miss can have a huge impact on them.
Thank you so much. Niamh, what about you? Final comments in relation to, from your perspective?
Thanks. Well, it's slightly related to this topic, the constipation. Lisa educated us all on this. I know you're sick talking about it, Lisa, but I don't think we realised, and certainly across pharmacy, across secondary care, I'm not sure we realised the significance of that and the impact of addressing that issue could have on making something different for people. And we'll continue to work with Parkinson's Ireland, so look forward to more collaborative work, and thanks again for being part of this today.
Thank you, Niamh. Maria?
I suppose we should really embrace these challenges. I mean, it's getting medicines on time, and then I'm thinking in the hospital setting, when the meals come around and what time that is, and then the meal is different. It's not the same protein content maybe that the person would normally have. There's so much to kind of confront, but we have to do that and keep moving forward. So you know, it's been inspiring working with Liam. He's been absolutely fantastic, and I appreciate the opportunity to work with the QPS team here as well.
Thanks,
So.
Maria. Ali, what about yourself? Have you any final thoughts?
For me, Louisa, look, with any quality improvement, it's keeping it on the agenda and sustaining that momentum. A lot of us will have med safety, drugs and therapeutics committee, so add it as an agenda item, time critical meds, keep the momentum moving. I feel we've kind of started a process here, and I think we know what our end goal is. We're not there yet, but we have to keep talking about it, keep it on the radar.
That's great, Ali. And I'm going to leave the final word to Liam.
Right. Well, I want to get paid in the future. So I think it's been covered, but we need to make people aware of Parkinson's and the complexity of the illness. And also that if a patient goes into hospital with constipation, but Parkinson's is not considered, or something like that, where the Parkinson's disease is not considered and is responsible for the ailment, that should also be emphasized. And then back to the everything, timing, patiently, is critical.
Thank you so much, Liam. And I suppose from my perspective, I have been honoured to be a co-host here today, and I've learned so much, not only from, you know, the expert panelists that we have, but the most expert of the panelists, which was Liam. And I think we've all touched on it, what we learned from Liam. So I just want to thank all the panelists for giving their time and for coming and, you know, providing us with such, I suppose, expertise and such knowledge this afternoon in what is a very busy lunchtime of the middle of October. So Anita, I'm going to pass back to you to finish everything off, hopefully.
That's perfect. Thank you. And just to say thanks again to everybody. Just to share with you just a few bits and pieces from QPS TalkTime's perspective, there is a sort of a special session on implementation science that's going to be run by Queen's University in Belfast with a gentleman called Professor Jeff Curran. He's a director of University of Arkansas for medical services, medical sciences, in the Centre for Implementation Research. Now, there's a lot of thinking in quality improvement spaces at the moment around using an implementation science approach to support quality improvement methodology. The thinking being that if we're trying to put time and effort into something, how do we ensure it sustains? And there's a lot of thought around implementation science and how we can take learnings from that to support quality improvement. I'd highly recommend, if you have an opportunity to join it, it's from 2 to 3:30 on the 1st of December. There's a QR code there, and Chris has popped the link into the chat. But I definitely recommend it, and Jeff has a wealth of experience. I think you'd really benefit from it if that's something that you're interested in. The other thing to say is the Quality Coach Development Programme. So this is a program that's been developed by our colleagues in the Health Foundation and NHS Elect to support leaders in quality and patient safety who have expertise in quality improvement methodology and have experience of doing quality improvement to develop their coaching skills so they can coach others. And it looks at things like the human side of change. It looks at working with people. It looks at the coaching and foundations of QI. And the idea being that you can then support others in quality and patient safety. So for the people that are on the call that are saying, that sounds like me, this is something I'm interested in, we have an information session on the 28th of October. It's at 3 o'clock. It's a 30-minute short information session. But if you can't make the session, you can still apply. And the link to all of the information is there in the chat box. So Chris, thanks very much for popping that into the chat. I'd highly recommend that you have a look at it. It's a short application process. You do need line management support. And I would say to you that if you're interested in developing your coaching skills, it's a really fabulous program. We have 2 cohorts running at the moment with over 50 staff on it. And it's really rich, the conversation, the debate, and then the opportunity to network with other people in that quality improvement space. It's really, really worthwhile. Just to say, our last podcast was with Dr. John Fitzsimons and Dr. Ulfat Sheikh. Both of them are pediatricians. It was developed for World Patient Safety Day. I would say there's stuff in it that's applicable to a much broader space because it's looking at quality and patient safety from the start. And the theme this year for World Patient Safety was safe care for every newborn and every child. But I would say to you that there are themes there that are applicable beyond World Patient Safety Day. And for people that are interested in quality and patient safety, take a look at the podcast series if you haven't already. There's some really fabulous stuff, from episodes with Helen Bevan, there's episodes on intrinsic motivation, liberating structures, quality improvement in action, and so much more. And we have another few excellent sessions coming up over the next while that you'll see on wherever you get your podcasts. So just to say, you can watch back all of our QPS Talk Times on YouTube and also on Spotify, and you can have a look back then there. You can keep an eye on the National QPS on LinkedIn for upcoming sessions, and I would say to you as well, just if you haven't already, join our mailing list, because the mailing list is a really good way to keep up to date on what's coming for you. And I'm going to stop now and say, we have a very short survey, so if you haven't had a chance, just take 2 minutes just to fill in this survey. It's really helpful for us to know, are these webinars helpful? Are they hitting the mark? Is it something that you have thoughts on in terms of what else would be beneficial for you in your role? And I would say to you, thank you so much for joining us today, and best of luck. And just thanks finally again to our panel. Thanks everyone, and have a lovely afternoon.